Stroke occurs when blood supply to the brain is blocked or when blood vessels in the brain burst. It is one of the leading causes of serious long-term disability in the world. About 15 million people worldwide suffer from stroke every year. 1 in 20 adults in the developed countries is affected by stroke. Stroke is a major cause of disability and it affects the quality of life of the survivors in their daily functioning in the workplace, home, and community. Recovery of the motor function after stroke is crucial in order to perform activities of daily living, but this recovery is often variable and incomplete. Despite advances in neuromedical care and rehabilitation, such as physical therapy, and robotics assistant rehabilitation, 40 to 50% of stroke survivors are left with permanent neurodisability. Based on EEG-based brain-computer interface, BCI, technology, a portable device that detects imagined movement of stroke-affected limb to provide visually engaging feedback, exercising the brain for post-stroke recovery, named Nbetter, is developed. Built on the most advanced BCI technology and innovative clinically tested algorithm, Nbetter can be applied to detect patients' motor intent for chronic or subacute stroke rehabilitation. After the caregiver helps to put on the EEG cap on the patient, normally the EEG gel needs to injected to ensure the low impedance level. When viewing the game from a first-person perspective, where a virtual avatar's hand is holding onto a peg placed on top of a grid of tiles, the patient will be prompted to think of a hand movement action by an arrow cue on the screen. When the BCI correctly predicts that the patient is performing motor imagery in a trial, a smiley face will be displayed and the peg will move from the center of a tile to another. As the peg moves, the tiles along its path will disappear, revealing a reward picture underneath. When motor imagery is not detected, a straight face will be displayed and the virtual hand will keep still. Through this way, the motor imagination of the patient is performed each trial. Nbetter can be connected to robot or CPM machine to exercise the movement once the motor image is successful, that will help the patient to enhance the motor image and passive limb movement. Clinic trials were conducted in the local hospitals and patients were randomized into 3 groups. The first is the BCI-HK group, the second is the HK Robotic group, the third one is the group using the standard therapy. Each group receives about 1 hour rehabilitation for 18 sessions over a 6 weeks period. Assessments were performed using the Fugl-Meyer assessment, FMA, which quantitatively estimated the extent of neurologic deficit. All intervention groups improve, and this gain remained at week of 3, 6, 12, and 24. BCI and HK group shows the most improvement up to the 24 months when the rehabilitation has ceased for 18 weeks, addressing the ongoing neuroplasticity and long-term effectiveness. Can be used as a standalone application in the clinic, or deployed over a secured intranet or internet-based client-server architecture. The patient's information, performance parameters, and recorded EEG signals on the client's side are transmitted through the secured connection. The system also includes a web interface that allows authorized users such as clinicians or therapists to perform patient registration, and to input parameters of evaluation assessment performed on the patient, so as to monitor his/her rehabilitation progress. Statistical analysis and graph plotting tools are also available for in-depth data analysis. The data can then be accessed over the internet from anywhere, and the recorded score will be compared with past results to review the rehabilitation progress.